Living Room Logic. Welcome to Living Room Logic, a place for you to chill out and have a laugh with two scientists who know too much about very, very little.
This episode, I interview Dr. Liz Ryan, who is a talented immunologist and a passionate educator in the University of Limerick. We discuss the COVID-19 pandemic a year after it hit the Western world, what lets the COVID virus cause a pandemic, and how scientists have developed a vaccine and tested its safety in record times.
Don't be an anti-vaxxer and follow the podcast on Spotify or Apple Podcasts. Come find us on Instagram or Twitter or other social media that your great aunt shares misinformation on. Sit back and enjoy this contagious consultation.
Okay, so do you want to introduce yourself?
I'm Liz Ryan. I'm an immunologist, so I study the immune system, and I've been studying the immune system for 20 years. I have a PhD in vaccine immunology, looking at pediatric vaccinations.
Oh, wow.
And I've worked in infectious diseases and autoimmunity and cancer immunology in a number of different disciplines in universities and in industry, and also now I am teaching at the University of Limerick, where I work in the biological sciences department and teach on the bioscience program there.
That's really lucky and potluck for us, because I didn't actually know you got your PhD in vaccine immunology.
Yes, so I did my PhD looking at how you could possibly formulate vaccines to deliver them up your nose to generate better mucosa, like immune responses at the site of infection. So if you breathe in a virus or a bacteria or ingest it, just try and get a better lung or gut immune response. It's still something that hasn't really gone mainstream very much. There's one nasally delivered flu vaccine, but by and large, vaccines are still injected into your arm.
That's really interesting, because even with a nasal spray, it's a lot less invasive.
It's less invasive,
Yeah.
So it's obviously much more popular.
Of course.
A needle, a little bit less pain, but also it provokes your natural immune response, in your airways and in the antibodies where you need it. So it more closely reflects your immune response to the actual virus. But there are difficulties, and the reason why it hasn't become mainstream is because it's actually quite challenging to do this. And we know a lot more about how to deliver a vaccine in an injection.
Yeah, of course. It makes sense. It's really cool. We'll definitely have to pop back at that towards the end when we're talking about vaccinations. That's really cool. Anyway, I think we'll crack into talking about the big baddie in the room of COVID and what's been terrorizing our stay-at-homes for months now. The first question is, what gave COVID the ability to become a pandemic, as opposed to, because at the end of the day, COVID's a flu, isn't it? It's a virus. And when you get viruses, normally it will knock you off your feet. You'll be stuck on a couch, be stuck with a mug of Lemsip or hot 7-Up, your choice, getting spoilt at home. But what's the difference that makes COVID a pandemic flu?
Okay, so it's it's not strictly speaking a flu. It's a respiratory infection. Mm-hmm. Flu, it refers to influenza.
Okay.
And influenza also has the potential to become pandemic. But what you're asking is the difference between what makes me sick as a person when I get a virus. Mm-hmm. So for all intents and purposes, COVID-19 is just like any other virus that you could potentially get. The reason that it's causing so much chaos and caused a pandemic, which means it's infecting globally people, is because it's new. It's because it's a novel virus that's just recently emerged. And nobody on the planet had any immunity against it. So it goes beyond just you sitting on your couch. It has the potential to make everybody in the world sit on their couch because it can just spread. Other sort of seasonal flu or seasonal colds that you may get, which can also be caused by coronaviruses, these are less likely to cause a pandemic because they have, been previously out in the human population, and we've developed immunity to them. So while it may cause illness and outbreaks in individuals, it won't necessarily spread to the extent that COVID-19 has.
Okay.
But these things like there are coronaviruses that cause colds. So one of the common cold viruses is a coronavirus called OC43. And that has been around circulating for over 100 years.
Oh, wow. Okay.
There's some hints to think that it may have caused a pandemic in 1890.
Oh my God. Okay, right.
So that killed about 1 million people back in 1890. There was a similar kind of respiratory pandemic at that point. Scientists think it was this coronavirus, but it has evolved with us since then. And now because we have immunity against it, it only causes a mild outbreaks and smaller flu-like symptoms in smaller numbers of people.
That's really interesting. So, because I don't know, I suppose in my head and a few people I was talking to, I thought that it was more so that the virus was just so contagious that it had a special ability to spread, but it's almost more so that everyone's a blank slate. So it can...
Well, it's a blank slate, but it also... So there's two sides. I suppose there are two sides to this coin. Yeah. There's we all are just open to it and we have no immunity. But also this virus has some really sneaky properties that make it a very good virus causing a pandemic.
Good.
It has quite a long incubation period. So you can get this virus without displaying symptoms and carry it and spread it before you start to display symptoms. There can be people who are asymptomatic and don't get any symptoms and unknowingly spread it. So that also allows it a bit of time for it to spread. The original SARS virus, on the other hand, that also originated in Asia and spread back in the early 2000s, that was a little bit different and more easily contained because it was that bit more pathogenic, a bit more caused disease quicker.
Yeah. Okay.
So it was easier to isolate people because they displayed symptoms much faster.
Okay.
It was actually more dangerous and had a higher mortality rate than the current virus. But the current virus escaped, and we couldn't, and we weren't able to contain it.
Yeah. Okay.
So it's a combination of those things.
Wow, that's a
perfect storm.
Yeah, it is a perfect storm. It is, and it makes total sense. So when you say the incubation period, that's it's just sitting in you before it's actually making you aware that you're sick.
Yeah, so you get a couple. So when you inhale some viral particles, they come into your system and they will attach and go into your cells and start replicating. Mm-hmm. So it takes a little bit of time for there to be enough virus in your system for it to start causing symptoms and for it to start causing disease. So the speed at which the virus replicates is that lag time between being exposed to the virus and displaying symptoms.
Wow, that's
because the symptoms are a result of your immune system trying to fight the virus.
Okay, that's really, really interesting. So you're saying it's less aggressive, and since it's less aggressive, it's sneaky. Sneaky. Wow, and that does make sense. And just because it's something that I was wondering as well, where we're all so afraid of maybe if you're the person who's carrying it and you're the person who's walking around, and you need to look after yourself and make sure you're not exposing yourself to people. And especially with coronavirus, as far as I know, with COVID, it's people are afraid of giving it to their parents. Yeah. They're afraid that's the fear factor, because when at least you look at the stats, it seems to be the elderly who are really struggling with that. And that's something I was thinking about, and I was kind of thinking, oh, well, the elderly are vulnerable, and they're a vulnerable group. But then I kind of asked, why are they? What makes someone elderly particularly vulnerable? And I don't know.
Okay, so this is all to do with the fact that this is a new virus. Mm-hmm. So nobody's immune system has seen this before. Now, young people, particularly children, they have never seen any virus before, apart from what they've been immunized with or what they may have come in contact with, as they're growing up. Children and young people's immune systems are really alert and able to adapt very quickly to new things. And they still have all the, they're very able to respond quickly. as you age, you lose the ability to respond to new things.
Mm-hmm.
And you rely more on the memory of, recall response to things that you've seen in the past. So older people will have better responses maybe against flus or things that they've seen in the past, but they're less adept at quickly responding to new things. So it's because the coronavirus is new that they are very slow at mounting a good immune response to it.
That's really interesting. So it's like since I suppose kids don't have the younger you are, the less experience you have, and that's even going with the immune system.
So again, as you get older, you're starting to rely on immune memory.
Okay.
Your bone marrow isn't as active as it used to be, and the rate of formation of new immune cells sort of slows down a little bit.
Okay, that's really interesting. Yeah. Okay, so that does make a lot of sense. So this is the younger people, they can react to it much stronger, and the elderly, they maybe have a slower response, or maybe a weaker response to a degree.
Yeah.
Yeah. So, but then at that point, when people are getting sick, how is it actually treated? Because if the immune system itself isn't able to fight it off, how do you take patients and help charge it?
Okay, so this is the complicated part. So individual, whether you're young or old, underlying risk factors, all of these things play into how your immune system responds to and recognizes the virus. When your immune system recognizes and responds to that virus, it can go a number of different ways. So you can have a good protective response that will kill the virus quite quickly. And this happens in people who don't really get that. A lot of people will have very mild disease and won't display too many symptoms. Their immune response controls the viral infection without too much fallout. However, you have people who just start to get very severe immune responses against the virus that almost go over the top. So they get this excessive pro-inflammatory response that the virus triggers. Mm-hmm. And these are the people then who end up like really struggling to breathe and need to go to ICU and get extra help. So it's this really overactivation of an inappropriate pro-inflammatory response that needs to be treated. So there are a number of different therapies and different approaches that have been developed over the last year that have given us extra tools to treat people with severe COVID-19 disease. So there's a number of different strategies. So you may have heard about the Regeneron antibodies that Donald Trump got when he was hospitalized. Mm-hmm. So what this is, they're recombinant or like manufactured antibodies against the virus. So these manufactured antibodies can be infused into a patient early on in the course of disease and stop the virus binding to the cells and stop them viral replication, stop the virus getting in. The virus has to get into your cell to reproduce itself. So if you can block that with an antibody, it delays viral replication and allows you a chance to recover more quickly. So that's one strategy that has had a certain amount of success and is being trialed. But other very important approaches includes the use of steroids, for example, the drug dexamethasone, which is a very commonly available steroid, and that's really effective at dampening down the inflammation that the virus causes. And this allows the body chance to recover and, get function back in your lungs so you can breathe more easily. And there are other drugs, for example, drugs that are used to treat diseases such as rheumatoid arthritis, where you have a similar overactivation of your immune response. So some of these anti-inflammatory drugs are being now used to treat COVID patients with some degree of success. So this helps to get people out of ICU faster. So that's really, really important. So they really are the things that are most promising at the moment. There have been a few other suggestions of drugs that haven't been as successful. And people have also tried to infuse patients with convalescent plasma. So from people who have recovered from COVID, you will have antibodies in your system. And if you could get an infusion from someone else of their antibodies, it could potentially help block the virus replicating. But that's very difficult to regulate and to do in a very controlled way. So that hasn't been super successful, but the anti-inflammatories have.
So really, a lot of the treatments aren't actually treating COVID itself. It's almost giving the body a time.
Yeah.
it's giving it time because the immune response is actually, it's like playing catch up. It's trying to nuke it, and you're caught in the crossfire. And okay, so it is two different treatments. It's the trying to reduce your immune system response and the trying to slow down the viral replication.
I mean, there's also active research going on looking at antiviral drugs to target the viral replication specifically, but I'm not aware of any of those that are used successfully. There's a huge amount of research effort ongoing, and has been, like, the research in the last year has been amazing. It's been
exceptional.
It's been difficult to keep track of everything.
Absolutely. I can only imagine. Though that's a positive that's come out of it, that there has actually been funding given, and I'm sure all of this research will be carried forward for things that are good. And the investment is there. The investment in infrastructure and in technology. So
it shows how important research in understanding basic mechanisms of inflammation and response to infection is.
It's great. Now, with the treatment, the new thing going on with COVID is the new strains going around, and how the new strains are more infectious and they're causing more things like that to happen. Are the treatments impacted by that?
Well, a lot of the treatments I talked about, like this, they're host directed, so they're really about targeting the host inflammatory response. So they will work just as well and independently of the virus mutations. But it's important to know viruses mutate. All viruses mutate. What a virus is essentially a strand of nucleic acid, which is like a series of letters wrapped up in a little coat. And that needs to go inside your cell and it uses then your cells to replicate itself. Now, this nucleic acid is like a series of letters. As it photocopies this code, it makes mistakes, and there isn't a good spell checker.
Okay.
So there's constantly, these little mutations are constantly being introduced as the virus replicates. The virus will replicate a huge amount in a person. Some of these are harmless. They make very little difference. And some of them help the virus adapt better to the host.
So it's kind of, if what the new strain would be then is one of these mistakes that actually was beneficial for the virus to spread.
It was somehow conferred some advantage that this particular error, those viruses were fisher and could replicate more easily. Okay.
And regarding this new strain, should we be more concerned? Like, how has it changed the dynamic?
Still to be determined now. How this will play out, I'm not sure. But viruses mutate. It so far looks like it could change the how easily it's transmitted. So this virus replicates a little bit faster.
Okay.
So there's more copies of it, as then when you sneeze, you release more of the virus, so it can transmit more easily. Maybe latch onto your cells a little bit, a little bit firmer. So far, it hasn't changed the structures to the extent that it will impact the immune response or your antibodies that the vaccine will provoke. But mutations are not always bad. So, like the previous virus I talked about, the OC43, over time that has mutated to make it less dangerous.
Well, that's good.
So viruses actually want to live kind of more in harmony with their hosts. If they kill us off, they've no one to transmit to use. So they want to kind of come to an equilibrium with their host. So over time, it's likely that these mutations will accumulate, and I don't think we will declare the world COVID-free in 2 years. It's more likely that over time we gain herd immunity because of the vaccine, because of previous infections. And now it just it continues to mutate, and we sort of learn to live with each other.
Yeah. These new neighbors that we have to share the street with, I suppose.
Yeah.
You mentioned vaccines there. Could you just mention how they actually work? Like how does the COVID vaccine actually help you?
So this is all about memory.
Okay.
So I mentioned that the older people have immune memory to lots of different things. A vaccine essentially educates your immune response to generate antibodies so that you have memory cells in your system that when you see the virus for real, they are switched, they're recruited really quickly and you get lots and lots of antibody produced very fast. So it takes 2, 3, 4 weeks to get good antibodies the first time you see something. So the first dose of the vaccine will take 2 or 3 weeks to start making, before you start making good antibodies.
Mm-hmm.
But the next time you see it, you get antibodies much faster. So within 2 to 3 days, you'll have antibody and much higher levels of antibody and much better antibodies that bind really tightly to their target. So for the vaccines, you get one shot, and then 2 or 3 weeks later, you'll get a second shot. So that then by the time you actually see COVID in reality, you'll have really good memory responses built up so that you'll have antibodies to call on very quickly.
That's really interesting. So in a normal situation, if you were exposed to COVID, your body would kind of be living with COVID for up to 2 weeks before you could really begin putting together a defense.
So the immune system has a couple of layers to it.
Mm-hmm.
So when COVID comes in, first of all, it triggers what's called your innate immune response. So these are, the first inflammation responses. So that early inflammatory response that can sometimes escalate out of control, that happens very fast.
Mm-hmm.
But what takes time are what's called the adaptive immune response. So these are the cells of your body that makes antibodies and cellular T cells that will come in and actually kill the virally infected cells. So that takes a bit of time for those to become educated and switched on.
Okay.
And you really need that second arm of the immune response to be activated to clear the viral infection.
Okay. So what the vaccine's doing is when you just face COVID, it can take up to 2 weeks to actually activate that second phase, that memory phase. But with the vaccine, it's happening in
it's accelerating that.
Yeah, it's accelerating. So in that incubation phase where you don't have symptoms, with a vaccine, your body's already reacting.
Exactly.
Okay, that's really interesting. So, but does that mean then, even if you're vaccinated, you can still be a carrier of the virus?
Yes, you can.
Okay.
So, the virus can still go into your mucosal, the linings of your nose, and breathe into your upper respiratory tract. So you can still carry the virus and still have low levels of virus, even if you are vaccinated. It's very unlikely that you'll completely wipe it out.
Yeah, okay.
This would be one of the advantages of having a locally delivered vaccine that could help kill virus particles in your nose and upper respiratory tract quicker.
It'd be very direct. Right at the front line. Yeah. So if we're still kind of carrying it, that means that at least for the next while, masks won't be going away, will they?
Masks and social distancing will be with us for some time to come.
Yeah.
Yes.
Okay. Yeah. And the masks, they do they just catch the virus like a net? I don't. Is it that when you're wearing the mask, it's just that the virus doesn't spread quite as well?
Well, what the masks do is they really make a barrier to stop the area to which the virus can spread into. Okay. So when you cough or sneeze, you form droplets. The little droplets if you have no mask on, the droplets will actually spread over quite a wide area. You'd be quite frightened to see the radius of your droplets. So you can spread quite widely if you have no mask on. So what the mask does, it stops the spray of droplets going into a wide area around you. The majority of masks don't have pores small enough to actually stop the virus getting out.
Okay.
But what they will do is they'll stop the droplets that carry the virus.
Okay. So it's kind of like if between let's say a 2 meter social distance plus a mask, it means even when you're normal breathing, your breath just doesn't go as far. It's muzzled.
It doesn't go as far, and it's stopping the big drops from getting out.
Okay, yeah. Okay.
So you can see it's not sterile. It's not keeping anything from going. It's not, but it's really helping, and it's helping keep things within this small radius around you. So if you have your mask and your 2 meters, it's very unlikely that something will get beyond that. Okay. A mask doesn't replace social distancing. You need both. Okay. So, the mask will help keep the virus within 2 meters of you.
Yeah.
And then if, you just don't want people coming within that space either. And then that will help.
Okay. And the last question I want to ask is something that I know it's come up in a lot of conversations I've had with friends, and it's now that we're kind of on the hill that we're all looking to when we're going to get vaccinated. There's an edge of fear in people because it's fast and it's been very quick. This research that's come out, and what I want to ask is, how does that process work, and how are the vaccines tested for safety to be administered?
Okay. Exhaustively, actually.
Okay, good.
I previously worked in a vaccine company, so I have a little bit of experience of seeing firsthand how cautious vaccine companies are, because they do realize, unlike drugs that treat sick people to make them better, vaccines go into healthy people to stop them getting sick. So the last thing you want are vaccines that will cause any adverse events, so you want to make sure that they are as safe as possible. This vaccine was quick because there was unprecedented global funding, cooperation, and need for the vaccine to be quick. All the stages have been gone through, all the normal research and development phases have been gone through, but they have been accelerated because they've run some of them concurrently, and they have had way more funding and resources at their disposal than they usually would. In general, to develop a new vaccine, you would stop between each of these phases, have to look for more funding, have to check the market is still there. But there's been an unprecedented demand, unprecedented resources, money. Like the whole world just needs these vaccines. The technologies that they have used, even though they haven't been broadly used before, are not super new. They have been around for a long time and have been researched very thoroughly. So the mRNA technology has been used previously for Ebola and Zika vaccines.
Okay.
And the other vaccine backbones, similar to the Oxford virus, the AstraZeneca virus, that is on a viral vector, an adenoviral vector.
Okay.
This class of vaccine has been researched thoroughly for 20 years. So there's a huge expertise and knowledge from years of vaccine research that has been going on behind the scenes, often quite underfunded. Industry and companies have been able to draw on this knowledge. So even though it's been fast, it hasn't skipped key steps, and the trials have been performed in large numbers of people, and the same safety checks done as you would always expect.
Like tens of thousands of people. So now, another thing that comes out that I think people would be interested in is you see like a 90% effective and 95% effective, and how do they actually figure that out? Like, because like you said, you're putting this into healthy people. You can't then give them COVID and see what happens.
You could.
You could, but I don't think they'd be signing up for it then.
It was discussed.
Really?
So that's what's called a vaccine challenge trial, where you would have volunteers who would you would vaccinate them and then expose them to the pathogen, and to see who would be protected. And that's a way of accelerating vaccine development. It's usually only done for diseases where you have a treatment, a very effective treatment. So it was considered unethical to do that for COVID because we didn't know enough about it to expose people deliberately. So what they did in early stages would be to inject people with the trial vaccines and look at the immune responses that individuals make. So you can check that they are immunogenic, that they are provoking antibodies, and you can measure that in the lab. So you can take blood samples and you can see that they're developing protective antibodies. And you can trial that in a dish to see if they can latch onto and neutralize antibody or viral infection of cells. So you can see if they're neutralizing antibody. And then they did placebo-controlled trials. So they did these trials in areas of the world that currently had active circulating COVID. And there was a placebo arm and a vaccine. So that meant there would be one large group of people vaccinated, another large group of people not vaccinated. They didn't tell them who was vaccinated or not, because that would very likely change your behavior. If you thought, oh, I'm vaccinated, I can take more risks.
Of course.
Maybe. So you don't know if you have the real vaccine or the placebo, and you're asked just to carry on about your normal life. Then over a defined period of time, they would look at who had clinically proven COVID infections. So the volunteers would be screened and checked to see who had the virus. And they found that viral infection primarily happens in the placebo group. And there was hardly any severe COVID infections in the vaccinated group.
Okay, so that's how they check the numbers that are... Oh, that's really interesting. That's really interesting.
And the studies for the Pfizer vaccine trials and the Moderna vaccine trials of similar technology gave very similar results, which was really encouraging, I think.
Yeah, that's brilliant. Well, I definitely look forward to getting that needle in my arm.
Oh, yeah.
And get that into me. And
those antibodies.
It'll be a good feeling to it feels like a positive step. It'd be like, oh, vaccination. We're getting there. Yeah, we're getting there. Like, we might still have masks and a bit of being careful with social distancing for a while, but at least once we have the vaccination, there'll be an edge off of it. I hope. Yes, well, it should hopefully. I mean, obviously, at the moment, the situation in hospitals with people with very severe disease is horrible to see. So really, we want to do everything we can to stop that. Yeah, of course. Yeah, which is isn't that why the health professionals, they're getting it first, because they were, if you're working with people who are constantly at high risk, everyone, a doctor in a hospital and a nurse that would be working with someone, they're already sick. The last thing you need is to have people who could be carrying significant amounts of COVID. Yeah, so it's to keep, it's obviously important for the healthcare professionals to keep them healthy, but also to stop them potentially infecting the sick people that they're minding. Yeah. Of course. Yeah. Well, I can't wait for that to them to get through all of them and to get to everybody else. And I'm sure that everyone could agree with. Well, Dr. Liz Ryan, thank you so much for that brilliant amounts of information there. Thank you so much. You're more than welcome, Andrew. It's lovely to talk to you. Lovely to talk to you too. I crawl out of bed and right into a shirt, walk 3 meters to my desk to go to work. I have 10 cups of tea a day to keep me awake. Up and down those bloody stairs, the only journey that I make. Should I take up running or play online board games? Maybe learn to knit or sew or write a book or go insane. Cause if I have to listen to the news, the bad, the good, then I'll go insane, become a preacher if I could. Cause this is your World War III, soldier, please step in. Not drafted to fight Germans, but the germs and you will win. You're stationed with your family, don't drive them round the bend. And if you have a problem, that's your problem in the end. Don't clap for nurses, they're too busy to hear. Maybe next time you cast a vote, you will think of them. The same goes for researchers, not as loaded as you think. Students working 50 hours for 200 a week. Of the world leaders, there is a divide. Those saving the economy and letting people die. And if you think this is 5G or some other conspiracy, next time you're at the pharmacy, buy condoms, please don't pass your genes, cause this is your World War III. Soldier, please step in, not drafted to fight Germans, but the germs and you will win. You're stationed with your family, don't drive them round the bend. And if you have a problem, that's your problem in the end. This isn't really Nam, Iraq or Korea. You're sitting on your hole complaining about the media. The people who have died for the life you have, they dreamed of coming home and many never have. So get a grip and stay at home. Sorry, your hair's a mess, maybe go and buy a comb. And hell, maybe you're right, the world will never be the same. But you know what I really think? I don't think that that's a shame.